Okay, well, good morning, everyone, and welcome to part one of our Professionalism webinar series. What we've done is we've divided this topic into a two-part webinar series, so we hope that you can all join us again on March 19th for part two. That will be at 10:30 as well, and we will send out some registration information for that in the next couple of weeks. If you're unable to join us for part two, all of our webinars are recorded and uploaded to our website, so you can watch at any time. So if there's folks that you know who wanted to attend this one, but were working or called into a meeting or something, again, this presentation is being recorded and they'll be able to find it on our website or our YouTube channel. So this webinar was developed to coincide with our recently released written guideline, The Importance of Professionalism and Presence in Nursing. And you can find that document on our website at www.anblpn.ca. So I really want to start by saying that Suzanne and I are really thrilled with the response to this webinar, and to have so many of you joining us today. I think this is maybe the most we've ever had join a webinar, so it's certainly a trending topic. And we have a really great mixture of LPNs, RNs, and nurse managers on the line today. So again, I just want to welcome you all, and thanks again for joining us this morning. So today's session is the importance of professionalism, presence, and civility. And we're going to focus on what the characteristics of professionalism are, including presence, how professionalism applies to nursing, and we're also going to talk about why we're accountable to be professionals. So, for example, what does our code of ethics and our standards of practice have to say about professionalism? And then at the end, we're going to open it up for questions and comments, and you'll be able to use the Q&A box that you should be seeing on the middle of your screen there. And so we thought it was an important, to tackle this topic because really society as a whole has been having issues with professionalism, and more we're seeing cases of professional misconduct that are starting to occur. And this has certainly been one of the primary complaints or concerns that we as the regulatory body have been receiving from employers. So I really think it's important for us to talk about this so that we can keep professionalism in nursing. Now, that being said, this is certainly not just an issue for LPNs, it's an issue for the entire nursing family. And really, it's an issue that society as a whole has been struggling with. So my name's Kathy Arsenault. I am the practice consultant for the Association of New Brunswick Licensed Practical Nurses, and I will be co-presenting on this topic today. I have the pleasure of welcoming my colleague and co-presenter for today's session, Suzanne Priest, who also co-authored the written guideline with me. So Suzanne is a registered nurse who's been practicing nursing for over 24 years. She attained her master's in nursing at UNB in the nurse practitioner thesis stream of the program. And Suzanne has a varied background, having worked in acute care, regulation, and she's now currently the standards and on-track coordinator for Horizon Health in Region 3. And of course, in her spare time, she also continues to work on a casual basis in the NICU. So, she'll have lots of spare time. So welcome, Suzanne, and I thank you so much for joining in the presentation today.
Thank you, Kathy. And again, I want to reiterate that I'm so I literally have tears in my eyes about the number of people that are tuning in, because this is such an important topic for our profession. And on a funny note, I am waiting to see if I'm working this weekend in NICU. So I'm just going to turn it back over to you.
Perfect. So I'd like to start this presentation by just showing you how professionalism and presence is inherent to the profession of nursing. So the diagram that you're seeing on your screen was drawn from our entry-level competencies, the code of ethics, and the standards of practice for both registered nurses and licensed practical nurses. And what I'd like you all to note is that all regulated nursing professionals are expected to demonstrate professionalism, and that this expectation is solidified in our code of ethics and our standards of practice. So when we look through these documents, we can clearly see that nursing professionals are to conduct themselves in a manner that upholds integrity and in a way that maintains values. Excuse me. We're expected and required to be a professional who demonstrates professionalism. So it's stated in those core regulatory documents. So as licensed professionals, we have to adhere to that. So I'm not going to read this all out for you, but if you do take a quick glance at it, you're going to see that these documents really provide statements like demonstrating professional conduct, maintaining professional competence and conduct, demonstrate professional presence, and maintaining values and the reputation of the profession. So that really brings us to our next slide, where we want to define professionalism for you as both a noun and a verb. So nursing care providers study from the science and art of health, because nursing is both a science and an art. And professionalism is realized through those purposeful relationships that we have with clients and the healthcare team. And as our slide says, professionalism, is an overarching term that includes your appearance, your behavior, your competence, and your job role. It's characterized by people who share the same values and similar education. And part of professionalism is being accountable for our actions. So when we say that professional behavior includes basic manners, that's often referred to as civility in the professional literature. And the opposite of civility is obviously incivility. And when you go to the literature, the research really focuses more on incivility. And so after Suzanne and I reviewed that literature, it really became evident that there were certain themes regarding the impact of incivility. And so we want to share those with you now. So incivility has really shown to have a very negative impact on staff health, client outcomes, employer concerns, and the workplace environment. And I'm sure that we can all think of a time when someone's behavior in the workplace has kind of made us feel bad about ourselves, put us in a bad mood, and then that in turn comes out in some way in our client care interaction. So if you think back, maybe there was a time that you were too sharp with one of your clients, maybe you disregarded a client out of frustration, and you can see that that can spread into a negative work environment, which is really what that picture is showing on your screen. So that kind of behavior can really start to have a ripple effect in our workplaces. So it's really a reminder of our conduct. It can be simplified to this thought process. Be the nursing professional that you would want to work with and the professional that you would want to be receiving care from. Because when we stop and think about it that way, it can really change things for us. And for me, it really makes me stop and reflect on my behavior or maybe somebody else's. So, you know, I think we all want work to be a positive place. Nobody wants to be miserable at work, especially since we spend so much time there. But we're definitely in very challenging times right now, which has not been easy for anybody. And I'm sure a lot of us have had a moment because of all that's going on around us right now. But it's because of these challenging times that it becomes even more essential that we maintain our professionalism and that we're remaining civil with each other, because teamwork is really just so vital right now. So at this point, I'd like to launch a poll question to you all while we're on the topic of incivility. And your responses always may, you know, they're anonymous, so don't be worried about answering the question. So I'm going to launch the first one. So it's just asking you if you have witnessed incivility in your workplace. So I'll just give you a few seconds to respond, just yes or no to that. Answers are still coming in. I'll just give you a few more seconds there. Okay, so I'm going to just share the results with you. So you should see on your screen that the results are pretty overwhelming, that 96% of you have said yes, you have witnessed incivility in the workplace, and only 4% of you have said no. So I'm going to just ask a follow-up question to that. So if you have witnessed incivility at your workplace, did you intervene or address it? So I'll give you a few seconds to answer that question as well. Just 4 more seconds. Okay, so those are a little bit closer together. So 60% of you have said yes, you did address it, and 40% of you said no, you did not. Okay, so I'm just going to take that down off the screen now. Interesting results. So now that we've talked about incivility, I want to talk a little bit about civility, the opposite obviously, and what does that mean? So civility is really, it's an awareness of being polite. It does not depend on liking everyone. It requires thinking before you speak, which is a big one. It may mean that you agree to disagree, and it includes what is spoken, what is written, and your body language. So these are really simple actions that I just read off, yet it does seem to be the hardest for people to understand and the area where we see people struggling the most. And so because of that, I really think that we need to start embracing some strategies to improve our professionalism, and that includes being civil and polite with each other. So in an earlier slide, we did state that part of professionalism was taking responsibility for our own actions. So if we each do take responsibility for our own actions and our reactions, and if we all start advocating for change in some small way, then there's going to have to be a shift to increase civility and improve professionalism in our work environments. And if you can identify triggers that really just zap your patients or it causes a really negative reaction from you, you can better respond to those situations in a professional way. So again, I'm sure we can all think of someone or something that just sends us right into orbit as soon as they come into the room. We are humans, but we still have a responsibility to control our reactions and maintain our professionalism. So when that gossip reaches you, because you know it always does reach you eventually, remember to just be a duck. So we got our little ducky on the screen there. Let that gossip just roll off of you like water rolling off a duck's back. And like I just asked in the poll question, make sure you speak out, respectfully of course, when you do witness that uncivil behavior. You want to be advocating for civility to be addressed in your workplace. And so this is where management also has a responsibility to ensure that the workplace remains civil and that they respond when it has become uncivil. And apologize if you are uncivil in your words or your actions. So again, we're only human. Humans make mistakes. Sometimes we say things and we regret saying it. I'm sure we've all been guilty of responding inappropriately at some point. But if we do apologize for our mistakes, it does still show that commitment to civility in the workplace. And I just want to take a moment here before I pass it over to Suzanne to just acknowledge that we are working with a high amount of a multi-generational staff. So in any given workplace, you may have up to 4 different generations that are working together. And it can be, funny to compare the different ways that these multi-generational workforces think and prioritize values. But at the same time, it can also be a really great source of tension for people in the workplace. So, depending on how old you are, I'm sure every person can think of an incident when someone from a generation different than your own has really challenged your ethics, they've challenged your values, they've challenged your patience. We've all had those moments where, again, depending on which age group you belong to, we've thought or said things like, ugh, these millennials, they're just so entitled. Or you're on the other end of the spectrum saying, ugh, these boomers, would they just retire already? And the truth is, we react that way because we really and truly don't understand, because we have grown up in such different environments that may have had different values. And so the literature is really repeatedly showing us that workplace stressors and coworkers with different values related to work can really be a battleground for negative reactions. So I just want to remind us today that although we're not able to change the shortcomings in our current healthcare system, we're not able to change the people that we work with, we do still have the ability to provide that safe, competent, and ethical care despite this. So I'm going to pass it over to Suzanne to continue on with the workplace.
Thank you, Kathy. Oh, sorry. I'm just going to go back. We're just going to try it one more time, folks. Thanks there. We are in separate rooms because of the pandemic and because of precautions. And so that's why we just had to take a few seconds to do a screen switch of control there. So thank you, everyone. So everything that Kathy has mentioned up to this point, I wanted to just reiterate that there is evidence-informed documents in which we are pulling this information from. So at the end with the Q&A, if you have specific questions or down the road you want to email us, this is not just something that Kathy and I are pulling out of our brains. We are literally going to research, to books, documents, and so on. So I just wanted to show that with, or share that with you. So she was talking about being the nurse or the care provider that you would like to work with, and also that you would like to receive care from. And one of the things that the literature really points out is that as a team, feeling a sense of community and trust in the workplace are very closely tied to job satisfaction. And for the managers in the crowd, or if you've ever worked short on a shift, less absenteeism. So when there's trust in the team, it shows, it's been proven, less absenteeism, and also greater staff retention. There have also been some studies to show that there is greater patient satisfaction, so better client care. And one study I like to talk about is a Canadian study in which it was quite a simple study, but yet I find it very interesting and I wanted to share with you today. So acute care settings in Ontario, and by acute care, I mean it was known to be quite a rigorous nursing environment. And they wanted to do a study to see if stress levels amongst the nursing team would change if they introduced education related to teamwork and trust. And so they tested the staff prior to their educational sessions, and everybody ranked their stress level. And then they did some lunch and learns, or I forget exactly, but it was educational sessions on site with the staff related to team building, teamwork, and therefore they were trying to address trust amongst the team. Then they reissued the same self-analysis, and what they found was that with team building, there were increased trust levels amongst the team members, and they ranked their stress levels at work as being lower. So same acute care facilities, same intense work environment. The only thing that had changed was the intervention of team building and trust. So I think that that is something that we can't ignore. And it's, you know, if you stop and think about it, if you trust someone that you're working with, you are going to feel a less level of stress. So with that, I ask you a point to ponder. I'm not going to ask for you to answer because I think this is one of the takeaways that I really would like for people to mull around in their brains. How much do you trust your colleagues on your nursing team? And if there is a lack of trust in the team, what do you think that could be done about it? Kathy mentioned, you know, the importance of apologizing if you have made a mistake, because you're going to make a mistake. Recently, probably a few months ago, I was in a teleconference call and my tone of voice wasn't as professional as it should have been. And so I apologized. It's something, I'm not saying I'm a heroine, but it was something that I immediately thought, ooh, that was not good. We're working on a project. We've got to continue to work on this project together. I need to be kinder and more professional. So that's something that, one of the takeaways that I just wanted to share with you today. This one here, I love humor. If you know me, you know I love food and I love humor. And so I put this up here because many people are familiar with the work of John Maxwell. And I just love this, that you can't be a smart cookie if you have a crummy attitude. And so really what I'm trying to say is that you could be the most astute clinician on your team for that shift, but if you have a crummy attitude, it's not going to be a great shift most likely. And so this is just a little ha-ha, but it's also pointing out a point, or bringing out a point that your attitude and who you are as a person on the workplace and in your private life can impact both the teamwork, the patient care, but also the profession of nursing. So then this brings, now I don't want your eyes to glaze over here, because this is where we start to get into the the little, what some people might consider the soft aspect of nursing. But this soft aspect, the art of nursing, is so important. And professional presence is a core relational skill within our profession. And I just wanted to bring out one of the definitions is a reciprocal exchange between the nurse and the client, or the nurse and the patient. We do share a human experience. And with the ever-changing, you think about it, medications, if you're in an environment where you're giving IV medications, pumps, there's new equipment, there's new fall prevention strategies. Like, there's just things that are constantly changing. In the midst of our demands, in the midst of our technical equipment, we cannot forget about the art of nursing, that compassion in the care, and that no matter how busy we are or how short-staffed we are, we can't forget the team players and we can't forget the patients, because how we react to the stress will impact the shift and impact them. So what are some characteristics of professional presence? I'm going to share some of them one at a time on the slides so we can go over them. But what I would like for you to do as I bring each of them up, because self-reflection is something in the literature that is shown to make us better practitioners. If we self-reflect, what do I do really well? What could I improve on? So as I bring these up, characteristics of professional presence, just ask yourself or think about it. And if you're in a room with other people, don't glare at anybody or say, this one applies to you. Just be collegial. So here we go. One of them is being accountable, ethical, and honest. So when you say you're going to do something, or your nurse manager has asked you to do something, do you do it? And if you can't or you haven't, are you honest about it? The other thing is the code of ethics. Be familiar with the code of ethics. One is being respectful in words and actions. So Kathy alluded to this. With words, it's pretty easy. Body language is another thing. Sometimes it's hard to control our body language with an eye roll, or maybe like a stance with our body. I wanted to bring up the positive side of that, though. Think about, and I have seen this before, when we've been in the neonatal unit, things are really, really busy and chaotic. If you're walking quickly by and you just give one of your colleagues a smile or a thumbs up, or maybe, make a little positive comment, it really does give you some fuel for, to your step and to the shift. One is being collaborative. And that means with all nursing care providers and also the interdisciplinary team. So the physicians, the unregulated care providers, and like if the dietitians or whomever comes to the floor, being collaborative. Being clinically competent. So as Kathy alluded to before, we are responsible for being aware of what we know and what we don't know. And if we're being asked to do something that we aren't competent in, then it is our responsibility to voice that. And that will, if you think about it, if you're going to work and you're feeling assured in your ability to do what's expected of you, you're going to portray more professionalism. You're going to have a better stance of, I do know what I'm doing, and you can trust me, patient and patient family and colleagues. The other one is having a sense of optimism. And really right now, in the midst of this pandemic, all you have to do is turn to social media, and you know that we are, as a whole in society, not in a state of optimism. This week, the news headlines in New Brunswick about visitation policies and so on, again, not a state of optimism. And so doing what you need to do in your personal life to try to keep you as a human optimistic as possible. Having compassion and empathy will be impacted by that optimism. And using professional language. What I'm getting at here is it's very easy at the nursing desk, or if it's night shift, to go down the road of perhaps having unprofessional discussions or using language that is not professional. it might not be swearing and cussing. It could be just even lingo and colloquialisms that really aren't meant to be in the workplace. So you could say to me, okay, Suzanne, that's fine, but really, if I'm really good at starting an IV and doing meds and performing, you know, whatever's asked of me from a task perspective, isn't that the most important thing? Well, yes, those things are very important. We're not going to throw the baby out with the bathwater, but truly, whether we are professional or not does impact the relationship between ourselves and our patients. And it will impact, studies show, eventually how the patient outcomes happen. So a consistent exposure, this is from when you look at CRNNL, that is Newfoundland and Labrador, and Nova Scotia is the NSCN. From 2019, they shared in one of their documents, a consistent exposure to professional presence will most likely foster a therapeutic relationship between the nursing professional and the client. I also wanted to share one of the UMB professors in Moncton, Catherine Aquino Russell. She was a great mentor of mine. She wrote a couple of things that really I feel noteworthy. Speaking with confidence and compassion as a nursing professional often results in the reassurance of the nurse's capability and their sense of being able to meet the demands of the job and also the needs of the client. So again, that's what I was alluding to before, that sense, that positive therapeutic nurse-client relationship will foster compassion and will foster the family's trust and the patient's trust that, you know what, I am in good hands. The other thing that Catherine Aquino Russell wrote about was professional presence is not something that you can just take on or put on and take off. So I'm going to put it on because I'm going into the workplace, and then I'm going to take it off and live however I want in my public life. Whether we like it or not, how we act in public and what we post in our social media posts does have a reflection on the profession of nursing, because if they know you're an RN or an LPN and you are consistently posting or acting in an unprofessional way, that is going to cast a little bit of a shadow of unprofessionalism on our profession. And I know some people do not like that, but it is true. So here we're just showing a little funny again, the nurse at the end of the bed. Hi, Mom, I'm taking care of that guy who was in the big accident on the news this morning, but don't tell anyone because nobody's supposed to know he's here. So again, to this, we're just alluding to the privacy laws, which are also going to impact the therapeutic nurse-client relationship if we are sharing information to our family members or our close friends that we're not supposed to be. So now this is something that I want to start off with a little story. If you've heard me present in person before, I want you to imagine it's pre-pandemic and you're at one of the airports in New Brunswick and you are waiting on the plane, and this guy or girl, so I'm just going to go guy, walks on the plane and he's wearing khaki shorts and a Bermuda type button-up shirt. And he's got a toll painted pin that says, Joe, comma, pilot. How would you feel and what would go through your mind? I know if it was me, I'd be like, who just walked into the cockpit? And if he's flying the plane, I'm not sure I want to be on it. So I know that's funny, but we're trying to bring out a point here, is that our patients and their families do judge us by our appearance. A first impression does communicate how we feel about ourselves and whether we respect ourselves or whether we really do care about coming to work and looking professional or not. Professional image is reflected in being neat and being professional in appearance. So if your workplace has a dress code policy, there's a reason for that. It's most likely infection prevention control, and also to have people that are receiving care from us to know who we are and to also feel comfortable that we are a group of professionals. I can't undermine the importance of wearing a name tag that's visible to the patient or their family so that they know, okay, it's Suzanne. She's the person that's providing care to my dad today. We sometimes can just take that for granted because it's just part of our everyday being, but it is so important to family members to know who is caring for their loved one. Or for me, if I'm in the hospital, who is my doctor? Who is my nurse? Who is my LPN or dietitian or what have you? Nursing professionals are watched by clients and their families while providing direct care and indirect care. And we put this up there because it's so easy for us, I mentioned it already, but to forget that we are still heard in the hallways, in the cafeteria, at the nursing desk. If you're leaving your shift and you're talking about, if you think about it, if I'm walking down the hallway and there's patients able to hear me or family members able to hear me, and I'm talking about what I'm going to do when I get home, and it's not something that would be professional or a professional reflection on nursing, then should I wait until I'm outside the building and then share it with a coworker? It's that type of thing that we necessarily don't think about. But it can impact whether we're seen as a professional or not. So I like to be hands-on and practical. So what are some things that we can do to improve professional presence? We can make eye contact with people and smile. I put this eye contact up there on specifically because we are living in such a digital age that all you have to do is walk through the mall or go to Tim Hortons or even go for a walk outside and you will see people with their eyes on a screen versus at another human. Introduce yourself to your clients. It's so easy in the rush of our shifts to forget to say, hi, I'm Suzanne and I'm going to be looking after you for the next 12 hours. Or, hi, I'm Suzanne, I'm your registered nurse and I'm here until 7:30 tonight. If there's anything that I can do to help you, I will try my best. Dress for your role and your audience. So obviously, if you're working in mental health, you're going to dress differently than someone that's in an acute care setting. So dress for your role and for your audience. Know your audience. I think of a time when I was doing community care and I was working with a population where I might have been judged if I'd gone to work all dolled up with a lot of jewelry and looking like I had a higher income than they did. So I was cognizant of that. And when I went to work in that environment, I dressed minimally and I made sure that I was plain looking, but also neat in appearance. Have body language that is open and relaxed and upright in posture. And what I'm meaning by that is that we really play such an important role in care provision that as RNs and LPNs, we need to feel proud of that and walk and enter a room with that confidence. Listen more than you speak. That would be my big, my big challenge. Match your tone of voice to the situation. So what I mean by that is that if you're in a situation where lower tone or a more serious facial expression is what's needed at that time, then do that. But if you're in a situation where someone could really benefit from a smile or from a little laughter, then know the situation and match your tone of voice and your body language to that. Practice humility versus arrogance or a know-it-all attitude. And so again, depending on the generations that you're working with, we can judge each other by, yeah, who does she think she is? Or, he really thinks he's something. Practice humility versus arrogance, and also be less judgmental if you are working with someone who has that, and then maybe ask them to watch this webinar. Just joking. Treating others with a positive regard and working collegially with others. Again, when you're working with a team that you all get along, this is so easy. But think about when you've come on for your shift and you've looked at the assignments and you have seen a particular name that you're going to be working with for the next 8 or 12 hours, and you've thought, oh dear heavens, it's going to be a long night. And then think about when you have come on, you've looked at the schedule and you're like, oh my land, it's going to be an awesome shift. No matter what happens, I know we will be okay on the other end of the shift. What was the difference? Yes, clinical competence plays a role in our reaction to that, but so does attitude, and so does professionalism. So remember, impressions matter, and we all create a first impression and an ongoing profession with the patients and their families. And then raising concerns, and I think this is the hard part. We saw in today's poll, 60% said they did something about addressing the incivility and 40% didn't. It's very hard. We can be very intimidated. But remember that when we enable, or if we turn a blind eye, it's probably not going to go away, but just get worse. And so raise concerns and encourage others to raise concerns. If you're a manager on the call today, I encourage you to foster an environment where people feel safe to come to you if there is something going on in the unit that should not be, or in the workplace if it's community setting, etc. So that's one of the things that I wanted to leave you with today. So in summation, and this is one of our last slides, key points of what Kathy and I wanted to share with you is that presence, although it's the art of nursing and it's that soft aspect of nursing care, it is a key component. Civility does indeed impact the staff, the team. It does impact patient care, and it does impact the work environment. If you want to attract people, if you want to keep people, that trusting, civil, professional work environment is key. Know about the multi-generation values and respect them. I remember working with some people that I thought, my goodness, they're a dinosaur. Like really, we are on such opposite spectrums. And now guess what? I'm the dinosaur. And I'm working with people that probably think that I am very old-fashioned. Professional presence impacts the therapeutic nurse-client relationship positively. It's not just something that is nice, it's required of us by our regulatory bodies and by our employers, and most importantly, it does impact our patients for the better. My next button, Kathy, is not coming up, sorry. Thank you. Value the profession of nursing through appearance, body language, verbal and nonverbal communication. And that's all I have today, and I will turn it back over to Kathy. Thank you.
Okay, excuse me. Thank you very much, Suzanne. And I do want to again just thank everybody for joining us today. We do hope that you can join us on March 19th for part 2 of the Professionalism series. And that one's going to be titled Navigating Professionalism in a Hashtag Era. So the second presentation is going to focus on topics such as obviously social media, generational shifts, and a concept that I'm just fascinated with, and it's known as the hidden curriculum. And I think that when we start talking about it, everybody is going to be able to relate to this. So at this point, I am going to stop the recording, and I'm going to open it up for any questions or comments that you might have. So you can type your questions into the Q&A box that you see on your screen. And to ask a question, you also have the option of remaining anonymous by clicking the anonymous button. So you don't have to worry if you don't want people to know what you're asking. So I think we have one there already. Can we get a copy of the PowerPoint slides? We can do that. I don't have a problem with that. Do you, Suzanne?
The more you share this, the better.
Yes, exactly. Perfect. No problem, Tara. So we'll just give you a few minutes. If there's any comments or questions or anything, just feel free to type them in.
If you are a person that likes evidence, just while we're waiting for that, I do have, even though it's dated, I have, for those that might be interested, an article. Kathy, I didn't share this with you before.